I know that a big part of the problem, you touched on this just a bit, and it's something close to you as a Black woman in America, a mom of two girls and a daughter of an Atlanta physician, is health equity. And
Yes.
you were recently featured in a Forbes article talking about the so-called, quote, call to action. So how do we begin to close this healthcare gap?
Yeah, absolutely. Well, I mean, I think the one thing we do at the March Times is we look at the health of every mom and every baby. And the reality is, we're not doing very well by a lot of moms and babies, irrespective of race and income and zip code and where you live. But it's especially true for women of color, where Black women, for example, are 3 to 4 times more likely to die as a result of pregnancy and childbirth. We still have infant mortality rates for Black babies that are twice that of white babies. We have to recognize that these inequities didn't just show up recently. We've actually been living with these inequities for a long time. When my father was practicing as a physician in Atlanta, he was addressing these issues. And generations before, we have had to deal with these issues over generations. What we're finally doing at the March of Dimes is calling them out, raising awareness around them.
Well, as they say, the time is now. I mean, this idea of call to action, we're seeing that, on many parallel paths in our society right now, whether it's the Me Too movement or BLM or the March of
Yes.
Dimes call to action, and people's voices are mattering now more than ever before.